Hello, beautiful people. I'm doing a vlog update. It's Saturday, about 5:30. I hope everyone's doing well. I've been sick this week. I ended up with a bronchial infection, bronchitis, and I think it's from being intubated twice within 5 days. But my fever seems to be going down. Doctors have been checking on me, and I'm better, and I'm thankful for that. It's hard to have this racking cough and try to protect the area that I just had surgery. In reference to the surgery, I have a drain tube, and for those that have gone through surgery that requires that as a post-surgical help, I've found a way to strip the tube that is really effective. When my friend was here from Asheville, I was nervous. You know, I would love to be a doctor or nurse, except there's blood and cutting on people and operations, so that's off the grid for me. So I'm a little intimidated by some of those procedures, but I have found if anyone's going through this stripping the tube to keep the drain tube clean of clots and so forth. Of course, you can't be over sanitized, and of course you're washing your hands, but Purell hand sanitizer has been the sanitizer that I've been given through my medical team. And if you keep your hands moist with that, you can slide right on that tube with no difficulty, and you can do what you're required to do without much grossness, with a quick execution, and succeed. So I wanted to pass that on. That's what I found. And there's Sophie right here. Hey, Sophie. So that's a tip I wanted to pass on. Also, I've had to administer shots to myself. Again, I'm not a medical person. And so that was a very difficult thing. And the first time I did it was a complete fail. But I found that if I do exactly a straight in angle in my leg and hold the skin tight, that it really, even though I expected it to be painful, it's not. And remember to get the needle in your skin before you press the plunger. That's where I messed up the first time, but I've mastered that. So those were a couple of things that I wanted to share with you. If you're going through something where you're required to do either or both of those things. I'm like an expert now. I don't even think about it 3 days in. So I hope that will help. I will see Dr. Massey next week. She'll again check this infection that I have and check the actual site where the second surgery was done. And I'm still having some pain, but nothing like the first of this week. I was in excruciating pain, but that has faded somewhat, and I'm really happy about that. Probably about the third day in, with the exception of that hacking cough. So imagine that this is very normal what I'm going through as far as 3 days in, the pain not so acute. I'm resting. All my friends have told me to rest this weekend, and I've decided to do it. I'm not going to do anything except snooze, watch movies, snooze again, brush my teeth, and go to bed. So there you go. I will see Dr. Brackett the latter part of next week. As I understand it, the margins were clean when they did the surgery. That's why they wait, this particular team that I have, they wait 5 to 7 days before they insert an expander. The purpose in that is that all doctors are to check the margins of the area that's been removed. So the pathology doesn't come back for 5 to 7 days. So if a doctor puts the expander in immediately and the margins aren't clean, then that's a $20,000 waste of medical material that one's insurance would be charged for. So I'm glad that they have that frugality about them concerning my insurance and what my insurance will cover. I will see Dr. Adams, the oncologist, about a week from now, and I think at that time is when they will start setting things up for chemo. I'm not looking forward to chemo. Been there, done that. I understand as to why that's going to be done, even though the cancer is removed. You know, there could be a cell that escaped or whatever. So that's next on the agenda. The Herceptin I'll take for a year. The chemo will be for 4 months, and then the reconstruction, I think, starts with more readiness. So that's kind of where things are now. I wanted to mention this too. This is really great. I began to receive these beautiful cards, handmade cards, hand-painted cards with all kinds of things, flowers, balloons, and of course flamingos. And the hashtag that was written on the cards, most of them handwritten, hashtag art from the heart, and then the second hashtag on some of the cards were hashtag hugs from the heart. So I asked Dana to look that up for me, and it's like an organization that supports cancer patients. I don't know how my name got in with this organization. I'm sure that a friend through social media sent it in, but it's just like a beautiful wave. And I have gotten wonderful cards, and they have cheered me so much. So that may be something that y'all want to check out. If you're supporting someone, if you're doing something through the church and you want to reach out to someone that's going through a cancer situation, check that out. Hashtag hugs for the heart, hashtag art for the heart. So on that note, I want to say that Taylor has adopted Sophie. If you've been following Sophie's story on Instagram, she is a rescue dog, and she is right here, ready to knock over the laptop. But anyway, all's good in Myrtle Beach. Chest infection's clearing up. My fever's down. I can strip this drain tube like a champ. I can give myself a shot without a flinch now. And I'm looking forward to things to unfold and get better and better. Thank you all for your support. Reach out to someone that needs support. Sometimes just the simplest thing, a smile and a hug, will make a tremendous difference in someone's life. I know y'all to be beautiful people and kind people, so just spread your love. I'll talk to you later. Have a good weekend. God bless you.